All right. Thank you all for joining us this morning for our webinar, Supporting the Youth Peer Support Role Within Your Organization, hosted by the Mental Health Technology Transfer Network. A little bit about the Mental Health Technology Transfer Center Network. There are different regions that are set up all across the nation. This is being hosted by Region 10, that is the Northwest Mental Health Technology Transfer Center region. However, this is one of our national webinars, our first national webinar, in fact. The Mental Health Technology Transfer Network helps to support resource development and dissemination, training and technical assistance, and workforce development to the mental health field. We work with organizations and treatment practitioners involved in the delivery of mental health services in order to strengthen their capacity to deliver effective, evidence-based practices to individuals, including the full continuum of services spanning mental illness prevention, treatment, and recovery support. This is a 5-year project that is funded by SAMHSA that began August 15th in 2018, we started providing services in November and hope to continue to do so over the span of 5 years. This is a slide that is included in all of the MHTTC webinars, and it covers people first language. So we like to just remind people that the use of person-first language helps inspire hope and advances recovery within folks that we work with. Words have power and people come first. So an example might be, rather than saying something like an addict or a mental health patient, we say somebody who experiences addiction or somebody who experiences a mental health challenge. We want to use affirming language to promote the promises of recovery by advancing evidence-based and culturally informed practices. So I'll hop right into introductions. So my name is Caitlin Baird. I'm a project manager and trainer with the Pathways Research and Training Center at Portland State University. I have experience working directly with transition-age youth and young adults as a peer support specialist and as a supervisor for peer support specialists in wraparound and other mental health settings. This, of course, that I myself have my own lived experience as a young adult with mental health challenges, and surprise, now an adult who still experiences some challenges, but knows it and has the skills in order to work through those. And I'll let Mary Beth, my co-presenter, introduce herself.
Hi everyone, I'm Mary Beth Welch. I am a peer support training specialist, again with the Pathways Research and Training Center. So I have lived experience as a young adult in the mental health system, the foster care system, and the special education system. I used that experience as a peer support specialist, or I did when I was a peer support specialist, and now I use both my experience in the systems and also as a peer support specialist to train peer support specialists and talk about peer support because it's awesome. So,
thanks, Mary Beth.
Definitely. So learning objectives for this webinar include understanding the youth and young adult peer support role, supervising youth and young adult peer providers, and establishing a supportive agency culture. When we talk about the youth, young adult peer support role, we'll be saying either all of that or also peer support in general, and when we're talking about all of that, that's what we're referring to. So we're referencing young adults who have lived experience in the mental health system or whatever system is they're being a peer support for, who work with youth and young adults that are currently experiencing mental health challenges or system involvement.
Thank you. So basically, we're not talking about adult peer support or family peer support,
right?
Just youth and young adult peer support.
All right, so a youth peer support specialist works with young people transitioning to adulthood who are usually involved in the child serving system. This could be foster care, mental health, or they are experiencing a unique challenge. Youth peer support specialists are typically close in age with the young people that they work with, but are usually over the age of 18. Youth peer support specialists use their own lived experience with mental health and child serving systems to relate and engage with the youth that they're serving. In their work together, youth peer support specialists help youth and young adults to identify goals and advocate for themselves. So this next piece is a little bit about what is and is not a youth peer support specialist. So this first part, youth peer support specialists build hope. They use their lived experience to kind of relate with the young people that they're working with, show them that there is a chance for a brighter future, even if things seem kind of bleak right now. So again, that lived experience refers to their journey through a system or a trauma or a unique challenge that the young person might relate to. So sharing your own lived experience can kind of really help with building that engagement and also help young people see that there are options for their own future. Another thing that goes into youth peer support is strategic sharing. So when the youth peer support specialist is talking about their own experience, they are doing it in a way that is going to benefit the young person that they're working with. So they don't necessarily go all into every part of their story all at once, but they share bits and pieces that are going to that might normalize what the young person that they're working with is experiencing, or kind of give examples of things that could be done, that kind of a thing. Next slide, please. So along with that, there is shared understanding that's promoted by a youth or young adult peer support specialist. So that's empathizing with the young person as they are going through a system, and there's the level of I've been in a similar situation, and that really helps with building engagement, and even if it's not the exact same experience, there's that similarity there that really helps normalize. There's also affirmation is used by peer support specialists to help young people identify their goals and validate that their own goals are important, and help them explore the situation, come up with a plan, and also create action steps. So I've mentioned this a couple of times, normalization is a very important part of peer support, and that just kind of helps prevent or rectify a young person feeling isolated about their struggles, and kind of, again, promotes that hope and helps the young person that they're working with feel like they're not alone in what they're going through. Another part of that is destigmatization. So there's a lot of stigma around mental health. And so what young adult peer support specialists work on doing is kind of helping young people not internalize the stigma that is placed on experiences that they might be having or situations that they are in. Relationship building is an important part of youth and young adult peer support as well. So they work on building rapport, includes using their peerness, which is relating to youth culture, talking with the youth one-on-one, and learning about the youth's interests, goals, and experiences. This is also a great place for the peer to bring in some of their own story, and also listen to the young person that they're working with and affirm their own voice. So it's really empowering. Individualized support is really important in youth and young adult peer support. So that's basically, you want to recognize that each person is their own person and work to their strengths, their needs, and their goals. So there's common misconceptions about peer support as well, especially youth peer support. So this can interfere with the youth peer support specialists being able to do their work well, and these misconceptions kind of happen because the youth peer support role is new and advancing, and a lot of people don't necessarily know what it actually looks like in practice. So here are some things that is not a part of peer support, youth peer support. You don't want to be a superhero, so you're not sharing your story and sorry, I went the wrong way. So when you're working with youth in crisis, you're not the one that's saving them, you're not the one doing crisis intervention. That can be part of it, but you're not the only person helping this young person as they are going through crisis. Also, a youth peer support specialist is not a therapist. They're not the only person providing emotional support to a young person experiencing something. They do not have a professional clinical background and shouldn't be making clinical decisions for the young person. This is where the peer support can help the youth identify and connect with resources that can work for them, whether or not that's clinical, and help them identify goals and strategies for achieving their goals. Another thing that youth peer support specialists and young adult peer support specialists should not do is tell the young person they're working with what to do. So this is something where, again, we talked about person first kind of thing. So it's really important to put the youth that they're working with, the youth's vision and goals in front of what they think that the young person should do. They shouldn't really have that. And so they aren't there to tell the young person what to do. They are there to help empower the young person's voices around what the young person wants to do and help them figure out how to make that happen. Youth peer support specialists are also not there to be a young person's spokesperson. They are there to help them figure out what to say and how to say it and what's important to them, to the young person that the young person wants to share. Again, it's very much about empowerment and supporting the young person in saying what they need. It's also not the youth or young adult peer support specialist's role to be the resource. This is where it's really important for the peer support to maybe help the young person connect to resources, but they aren't necessarily the one doing it, being the resource. So this really is important for upholding boundaries and helps youth identify and connect resources rather than being the one to meet their own needs. So this is what I went on a little bit earlier when I was talking about being the superhero. The youth and young adult peer support specialist also does not have the role of being the star. So yes, they share their story, but they are not sharing all of their story all at once, and they are also using it in a way that's going to benefit the young person. This whole relationship is about benefiting the young person, empowering the young person that they are working with, and helping the young person get to what they want and what they need. Another misconception that happens a lot is youth and peer support specialists are not the chauffeur for the young person that they're working with. A term that can often be applied or put to situations that peer support specialists are put into is a glorified taxi cab, and that is not what is supposed to happen. Yes, the peer and the young person might go places together, but it's all specifically relevant to the goals that are being worked on together for the young person. It's not necessarily about randomly after school the young person needs a ride somewhere so the peer can step in and do that. That kind of a thing.
Additionally, things like these are really important to think about because when we're working with young people as youth peer support partners, we want to think about how are they going to operate once we're not working in their lives anymore. So if the youth or the family becomes reliant on the youth peer support specialist, giving them rides all the time or meeting some other sort of a tangible need like that, we're actually putting them at a disadvantage.
So another one is that it is not the role of the peer support specialist to be a young person's babysitter. So oftentimes adults that are involved in a young person's life will want their peer to keep an eye on them or watch them during unsupervised time. And at that point, that's when a peer is going to need to clarify that that's not their role. It is their role to spend, yes, one-on-one time with young people, but that is working specifically towards the young person's goals and empowering them, that kind of a thing. So not monitoring them, not disciplining them. It's also common for people to consider peers as friends of the young people that they're working with, and that's not quite right. So peers build a unique relationship with the youth that they're working with, built on trust and mutual respect. But there's boundaries. So For example, a peer is not going to go to a young person that they're working with and tell them all about their horrible day, but they are going to be there to listen to the young person talk about their horrible day if that is what the young person is needing to talk about, kind of a thing. There are specific boundaries that go into the peer support role that isn't necessarily in like regular friendships. So there's the fact that youth peer support specialists are mandatory reporters, they're paid professionals, and they're not always going to be in the young person's life. So having those boundaries and recognizing that it is possible to be friendly, not friends, and also build in opportunities for the young person to find friends and build their own support network for when the peer is not going to be in their life anymore. It's also not a peer's role to police them. So it's not going to be the role of a youth peer support specialist to be like, ooh, that's your goal? Maybe you don't need to work, like maybe you can't make it to that, but what else can you do? Kind of a thing. If a peer is in a role working with a young person, the young person brings up what they want to work on, that's kind of the role of the youth peer support specialist is to empower them to try to reach that goal, or to empower them to talk to others in their life about wanting to work on that goal, kind of a thing.
Thank you, Mary Beth. So now that we've reviewed a little bit about the peer support specialist role, we're going to next talk about creating a supportive environment within your organization in order to support this role. As we mentioned earlier, there are some common misconceptions about the role and usually some lack of supports within an organization, simply because this is a very, very new role, and it's totally okay that folks don't really know what to do with it. So we'll talk a little bit about some training for your peer and your non-peer staff in order to support this role. We'll talk a little bit about policies and practices that can help to support this role, as well as how to acknowledge and understand the youth peer perspective in an equitable way to other professionals. So firstly, we'll talk about training for peer and non-peer staff. And something that I really want to highlight before getting into the nitty-gritty is it's really important that prior for peer staff coming on, that folks within your agency, particularly those who are going to be working with peers, truly understand the role. So there's a little bit of preparation that goes into this, I think, before immediately hiring on peer staff and then asking yourself the question, now what do we do? So some tips for this including both youth peer support staff and non-peer support staff should receive cross-training so that they understand each other's roles. So for me, when I was a youth peer support specialist and I was working within wraparound, I received the same training that all of the care coordinators did, and it was really helpful for us to do that training together so that we understood our unique roles and responsibilities working on a treatment planning team with a young person and what the roles and responsibilities of each person were. It was also really helpful for us to all have those materials to refer back to so that when something that was sort of a question around what our role was or other related boundaries came up, we could look back on it and say, well, this is what we initially learned about. How do we collaborate on this? It's also important that non-peer staff receive some training that is led and developed by peers. This is really important for creating equity within your organization and also for helping to learn a little bit about the peer perspective. So oftentimes, peer support providers receive training from folks who are clinicians, care coordinators, or work in other professional roles, but we don't see that sort of reverse training happening a lot of the time, which ends up leading to the peer having a really deep understanding of what these other roles might be responsible for and a lot of confusion around what the peer role might be responsible for. So I highly recommend that if you already have youth peer supports in your organization, asking them what they wish other providers knew so that they can develop some information, whether that be a manual, a PowerPoint, a lunch and learn, but something about that, and they can cross-train a little bit regarding what their role is, what they do, and why it's uniquely important. Additionally, professionals who will be supervising or working closely with peers should receive training related to the role, again, before youth peers are hired within the organization. So this doesn't mean that they need to know exactly how to go and be a youth peer support specialist, but maybe receive training from a youth peer and a professional who have worked together in the past to talk about what that collaborative process looks like and how they work well together. Additionally, training for youth peer support staff should be specific and clear about the duties and expectations of their role, and non-peer staff should understand this as well. Oftentimes, and I know that this happened to me when I was first a youth peer support specialist, youth peers are put into the role and just expected to sort of go and do without any really clear guidelines about what that might include, or any clear tools that they can provide to family or young people about what their role entails. They're told things like, you're meant to go and help them identify goals, but not really told about what processes or structures there are to do that. Fortunately, there are some trainings that are built specifically for youth peers that we'll review a little bit later that help learn and teach these techniques, and I'm sure that you're familiar with some of them yourself, such as motivational interviewing or collaborative problem solving, but youth peers should really have an understanding of how their role should operationalize in terms of helping to identify goals, helping youth advocate for themselves in the meeting, and how they're promoting collaborative and effective communication between the youth and their team without overshadowing the youth's voice. So I'm sure that many of you may know, but youth peer support staff will need to receive very specific training and certification that meets your state's requirements. This can be different from state to state, so I highly recommend that if you don't already have this on hand, that you look into it. It is usually called the Peer Delivered Services Training, and it's a 40-hour training for peers. There's specific ones to young adult peers as well that helps them understand the overall substance of their role. Usually non-peer staff are not able to attend this training. This is something that's sort of like a peer space for peers. However, your organization should connect with the training leads that lead this training about providing an orientation or 101 for your staff that includes the young adult peers. This might not be available in your area, but I highly recommend that it's something that you advocate for. Additionally, our team provides technical assistance on the role and would be happy to provide some sort of 101 or some sort of orientation for staff who will be working with the young adult peer support providers. So we had mentioned a little bit about specific trainings that folks might be able to access for youth peer and non-peer staff. So as we mentioned, it is similar for staff to have received some cross-training or similar training when it comes to the philosophies that will guide their practice in working with youth. Some of the trainings that we help facilitate through the Pathways Research and Training Center include the Achieve My Plan trainings. There's one specifically for wraparound and care coordinators who are working with youth in the wraparound process. Then there's AMP Plus for youth peers that's specific for youth peer support specialists working with youth in general. And we also have AMP for transition facilitators, which is specific for providers who are working with youth or young adults that are transitioning into more of an independent living situation. These trainings focus on highly specific and coordinated techniques that folks can use in order to remain youth-driven, strengths-based, help young people connect with people in community, as well as help them gain self-determination skills. So we find it's really useful when we talk about these broad philosophies to have specific techniques that are taught about in trainings like the AMP training in order to make those philosophies actually happen. Something else that we really want to highlight that is important for youth peer support specialists and just providers in general is really effective training. So I think that we all know, we've been to trainings before where we sit down for 3 or 4 or maybe even 5 days. We're given a lot of materials, we're told a lot of things, and maybe we're able to share and connect with some of our peers and leave the training feeling pretty good, but also don't really necessarily have tools that are going to directly impact our practice. So here at the Pathways Research and Training Center, we focus a lot on how can we implement practice change. And something that we have found that is really helpful is effective training includes a few elements, and we call this the gold standard of coaching. It includes observation, so staff members get to observe examples of good and maybe sometimes not so good practice. Then there's also feedback, so people actually practice the skills and then get specific feedback regarding the example that they've provided. Then they receive specific coaching on any strengths or improvables that they might have. And then there are specific benchmarks related to practice that trainers are looking for participants to meet. So in having this cycle of training, we find that people actually develop some pretty strong practice change. And that's really what we're going for when we're talking about some of these greater philosophies, right? Like youth-driven. What does that look like in practice? So we highly recommend that as your youth peers are going through training and your other staff are going through training, supervisors included, that you include some sort of elements of these four things related to the gold standard of coaching. Observation, feedback, coaching, and including specific benchmarks related to practice. Now that we've talked a little bit about training and how to help support peers and non-peers in training for this role, we're going to talk a little bit about policies and practices within your organization. Before getting into this, I want to recognize that not everybody has the position or the power within their organization to make structural changes like this. I do want to say, though, that the more advocates that you have, the more champions that you have within an organization who advocate for such policies, the better chance that you'll have of actually creating such. And the policies that we talk about here, while we are talking about specific benefits to youth peers and peer support, we genuinely believe it would support all of the staff in your organization. I've run this training before, and when policies and practices have come up, I've had lots of providers come to me after and say, I think that that would be good for anyone, and everybody needs that. And I completely agree. So I just want to highlight that before we jump into some of the more specifics around policies and practices within your agency. So the first thing is before employing youth peers, your organization should work with the Human Resources Department to ensure the following. Number one, hiring practice touch on the importance of lived experience, but without directly asking people about disabilities, trauma, or system experience, and leaving opportunities for candidates to divulge such if they want to. So I was actually at a training, this was maybe a month ago, and one of the supervisors approached me and said, we're trying to hire youth peers, but we're having a lot of trouble coming up with interview questions that touch on lived experience. What do we ask? And I said, I've experienced this very same thing as a supervisor and a member of hiring committees for youth peers, and of course, you do not want to ask things like, well, what's your trauma? Because that's not very trauma-informed and also just sort of terrible, right? But you do want to ask questions maybe like, what unique experiences do you have that allow you to relate to our young people? This allows people the opportunity to talk about their lived experience if they would like to, but certainly does not obligate them to. And they might provide some other interesting answers that really help you determine whether or not they're going to be the right fit for this position. If you have any other questions about that, again, as I mentioned before, we do provide technical assistance on things like hiring and creating good policies and practices for your youth peer support in your organizations, and we would be more than happy to talk with you or any of your agency leads about what the hiring process should look like. Some other policies that we recommend is that policies are flexible enough to allow youth peer supports to answer calls after hours, flex their hours as needed in order to meet with their clients, attend appointments that might occur during the workday, and promote positive work-life balance. So when I was a young adult peer support specialist, I know that my schedule did not follow a 9 to 5 at all. Typically, unless there was a meeting that I had early in the morning, I was starting my day around 10 or 11 and ending around 7 or 8 p.m. because in the evening is when it's easier for youth and young adults to get together. I would also frequently flex my hours to work on the weekend because, again, youth and young adults aren't available in the middle of the day. And something that's really just not, I don't think, best practice unless youth is really advocating for it is doing things that might make a youth feel further stigmatized, like showing up at their school or things of that nature. And you really want to make sure that in order to best serve your youth and young adult clients, that you're being flexible in order to meet their needs. So, as a youth peer support specialist, it was really important that I had that flexibility within my schedule in order to meet with all of the youth that I was working with and to answer calls after hours. Something that Mary Beth mentioned earlier, which I think is absolutely true, is that youth peer support specialists should not be the superhero, but they should be able to answer their phone in case some sort of a crisis emerges. The reason being is generally they are the staff member that young people will reach out to first, and then the youth peer support specialist can help support that youth in reaching out to crisis services, other staff, or natural supports in order to help them. But it's really affirming, and I can say this as a young adult who experienced mental health challenges as well, to know that you have somebody who you trust who's going to pick up the phone if you call. So it's really important that youth peer support specialists are able to have some of that flexibility and to communicate what their boundaries are around that. So I know for me, I would tell my young people if they weren't in crisis that I'm happy to talk to them, but let's make it before 8 p.m. If a young person's in crisis, though, they knew that I would pick up the phone. So it's really important that youth peer support specialists be able to flex in that way. Additionally, many young adult peer support specialists are still seeking some services themselves, just not within the youth system. So, for instance, I think that we all know a lot of therapists might only work normal 9 to 5 hours. It's important that youth and young adult peer support specialists are able to go and still receive therapy or even just to go to a physical or a doctor's appointment and have that flexibility to do that. So hopefully that's already built into your agency policies. I know that I've worked with some agencies before who are skeptical of whether or not youth peer support specialists are really using their time for that, and I just really want to emphasize that it's important not to stigmatize and to trust that this is a young adult professional who would behave in the same way as other professionals on your team, and that they're using their time honestly and wisely. It's also important that youth peers receive equitable sick, vacation, and mental health leave time, again, that is equal to their coworkers as well as a living wage. I've worked with some organizations that pay youth peer support specialists just not a living wage for their location, or might intentionally not make them full-time in order to withhold some benefits or something of that nature. And I just really encourage you, especially since this is a new role that we're trying to co-promote as a paraprofessional, that they should be treated with the equal and equitable benefits related to their other professional staff, including clinical staff, care coordinators, anybody else who they might be working with within your agency. Also, we highlight that agencies should operate from a trauma-informed lens and support self-care practices, and that this should be built into supervision as well. So I know that when I was a supervisor for youth peer support specialists, we had an ongoing self-care plan for them that we would check in about semi-regularly so that they knew that they had a self-care plan that they were semi-accountable for, and it was able for me as their supervisor to better understand things like the flexibility that they needed in their schedule, more of the supports they needed while they were at the office, at work, or while meeting with their clients. And it really ended up creating a nice, I think, not punitive and not scary supervision process for staff. So I highly recommend that as a supervisor for youth peer support specialists, and really for anybody, that you encourage and promote that they build a self-care plan, and check in with them about it at supervision, particularly if you know that they might be going through a difficult time. And when we say also that you're working from a trauma-informed lens, I really encourage you to think about taking a non-punitive lens for folks. So for instance, we understand that agencies have policies where sometimes disciplinary action needs to be taken. But for instance, if you're working with a staff member who's frequently showing up late, rather than immediately jumping to, if you show up late one more time, I'm going to have to punish you, working with them and asking them things like, so what is the need behind this? How can we work around this? Would it be better if we edited your schedule? Things of that nature to help your staff do the best job that they possibly can. So the next piece that we're going to talk about is understanding the youth peer perspective. So staff members should operate, again, from a trauma-informed lens, as we just talked about, and understand the stigma or systemic oppression that youth peer support specialists likely face. This should be seen as something that allows them to bring a unique perspective that challenges your team to improve, not as combative or wrong. So I provided consultation to some agencies who have talked to me about how youth peer support specialists just seem like they want to argue, and I really encourage you to not think about the youth peer support trying to intentionally cause disruption if there's some tension on your teams. I used to work with a wonderful co-trainer who was a care coordinator that would talk about the healthy tension, and she would say if you don't really have sort of a little bit of tension coming up or questions coming up with youth peer support specialists and family peer support specialists, then we're probably missing a need of the family. The reason being is youth peer support specialists are often advocating not just for what the youth or family is wanting, but also for maybe some of the systemic changes that they wish that they could have seen when they were a young adult going through the system. So we have to remember that the reason that we're hiring on staff like this is because we know that business as usual hasn't served everybody well, and we're looking to change that. So I really encourage you to come at that from a unique perspective lens that is going to help folks improve, not as something that's seen as, again, combative or incorrect, because it's not what has been usually done. So we're going to talk about some specifics regarding supervising young adult peer support providers. So number one is actively soliciting their input. What recommendations do youth peer support providers have to improve agency culture? In what areas would they like to grow professionally, and how can you help them get there? Excuse me. And then what are policies and practices that are working well for them that you can help support in your agency? You also want to help youth peer support providers balance support and accountability. This is really, really important. So again, we mentioned coming at supervision from a trauma-informed lens, and I think that that is super helpful. What that doesn't mean is that people are allowed to get away with not doing their job. So you want to be able to really ask questions, play to strengths, and make sure that you are being flexible enough to help support staff do the best job that they can. But if staff aren't meeting their basic job requirements, that's a problem regarding accountability. So you want to provide some reasonable accommodations while ensuring that they're still completing the job. Some examples that we've talked about are things like later start times so that they can meet with youth in the afternoon or evening, working from home to support mental health needs, things of that nature. So you want to make sure that, again, reasonable accommodations can be supported within your agency, that you're coming at things from a trauma-informed lens, but that this is all a result of your staff being able to do the best job that they possibly can, not creating excuses to minimize accountability. Other things that are really important for supervising young adult peer support providers include looking for signs of burnout and trying to interrupt it. So if an employee is not meeting their job requirements, they seem activated, remember that this may be due to burnout, and that's when you really want to refer to that self-care plan and see what is it that they need in order to best do their job. I think something that's really important too is making sure, again, that your agency policies support adequate sick time and mental health time for people to be able to avoid burnout. So what you really want to do is try and avoid burnout before it happens, right? So if you know that your youth peer support specialists are working with youth who are in crisis mode right now, or who might be a little bit triggering to them, because that might happen as well. Those are really important things to try and address ahead of time. Something that I used to tell my new youth peer support providers when they first came on staff was, I'm not going to kid you, this is a really hard job, and burnout will probably happen if we don't try to make a plan for it now. So when do you know that you're getting burned out? What can you do for self-care in those moments? How can we help interrupt that? And again, checking in about self-care. So youth peer support specialists and likely all of your staff should have a self-care plan, and discussing it should be normalized within your agency culture. Something that you can do to help normalize this, and we talked about normalization being something that the youth peer support specialist does, right? So there's some parallel process here, is that you can share what you do for self-care. What does your self-care plan look like? How do you know when you're experiencing burnout? And this will help people feel less stigmatized in bringing it up, and that means it'll be less likely to happen to them in the future, or at least they can bring it up when they feel like it might be happening. Other things that you want to think about when supervising young adult peer support providers is providing peer-to-peer opportunities. So many organizations only apply a couple of youth peer support specialists. I've even encountered organizations who only employ one. So it's really important in those instances that the organization has that peer-to-peer opportunities with other youth peers. So for instance, if you're working in a region that has other youth peers, make sure that they can connect with those youth peers. Additionally, as a part of the Mental Health Technology Transfer Center, we offer communities of practice for youth peers to join, which are monthly calls where they can come learn about something together, ask each other questions, get co-coaching, and also what we see is they get lots and lots of validation about things that might pop up within their role, and they find it incredibly helpful, and we've gotten that feedback both from the youth peers and the supervisors. So if you're thinking, well, Caitlin, how do I create peer-to-peer opportunities if there aren't any in my organization or my area? We are more than happy to provide that information in our follow-up so that your youth peers can join some of the communities of practice that are already set up. Peer-to-peer supervision is also very, very helpful. So generally, it's considered best if youth peer support specialists are supervised by fellow peers who have also acted in that role. This is usually combined in a dual supervision model in partnership with a clinical supervisor. So the clinical supervisor can supervise the youth peer on some of the clinical aspects of the young person that they may be working with, while the peer support specialist supervisor is supervising on how they actually actionize that in their role. Also, I want to highlight, I know that many agencies do not have the capacity for a peer to be supervised by another peer, simply because this role is so new and many agencies are new to the role. Again, this is where you really want to consider what kinds of coaching opportunities are available for your youth peers where they can get some sort of peer-to-peer experience, or what sort of technical assistance might your supervisors need in order to help supervise youth peers. So again, that's something that we offer through the MHTTC network. As somebody who has been a youth peer and both has supervised youth peers, I'm happy to chat with your clinical supervisors or anybody else who might be supervising the peer role about strategies that they can use to best do that. Something else to consider as you're supervising the young adult peer support provider role is supporting their professional goals. So as we can assume, many youth peer support specialists don't plan to be in that role forever. There is a bit of an age requirement, right? And we want them to be not necessarily, young adults, but youthy, as we like to say. And so you want to help them identify what their professional goals are and help them develop a plan of how they want to get there. Some key supervision practices to support peers include scheduling regular meeting times with your employees, acknowledging their strengths and accomplishments, as well as any room for improvement. Always follow up in writing. Nothing should ever be a surprise. And then checking in with the youth peer support specialist and their colleagues about how their work together is going. So I think it's really important if you're a supervisor who is overseeing the youth peer support role as well as other professional roles, about regularly checking in with those other professionals about how they feel in terms of working with the youth peer, because you might identify some gaps in their knowledge or areas where they might need support or more cross-training with the peer, so that everybody can be working together in a more collaborative fashion. So next we're just going to talk about some resources, and then we'll answer any questions that folks have. So the first resource that we recommend is at the Pathways Research and Training Center, which is the research and training center that both Mary Beth and I are a part of, that is connected in partnership with the University of Washington through the MHTTC network. Our research and training center focuses on a lot of training projects and a lot of research projects related to youth and young adult mental health, as well as peer support. And so you can find a lot of our resources at the link there. We have publications, webinars, and trainings that you can go and review webinar recordings of things that we've done in the past. But it's an easy-to-navigate website, which I really enjoy, and our training center focuses on a lot of these youth, peer, and young adult-related roles. Next, we talked a little bit about having specific coaching and training for your youth peer support specialists as well as your staff, and something that we really like to highlight because, again, it's connected with some of the training and coaching that we do is the Achieve My Plan trainings. These are trainings that have been validated through research. We see measurable practice change in folks who do these trainings, and they provide really core techniques that people can use in order to be more strengths-based and youth-driven. Additionally, all of these trainings happen remotely, so we do them online and then do web-based video coaching. So it's not something where we're asking staff members to take out 40 hours of their work week and their productivity time to do it. A lot of it can be done on staff members' own time. We try to make it as flexible and as responsive as possible. So that is definitely, if you're looking for how to train some of your staff or your youth peer support specialists on working with youth and young adults, it's something that we recommend.
These also utilize that gold standard of coaching that we talked about earlier.
Yes, thank you. Lastly, we recommend looking at the Effectively Employing Young Adult Peers toolkit. I will say this is a rather large toolkit, but it has lots of great information on how you can help prepare your organization to employ and support young adult peers. This is definitely something that we recommend if your organization is planning on doing that but hasn't done so yet. And it's something, too, where if you can take this to your agency higher-ups, it kind of gives them a workbook or a toolkit in order to help support and employ this role. So we definitely recommend that as a resource as well. So lastly, you can visit us online at www.mhttcnetwork.org. This will have information related to upcoming trainings, online training, resources, and research updates. And we'll have specific Northwest resources coming soon, but you can find resources related to all of the regions on this website. So next we're going to go ahead and answer any questions. It sounds like Kim mentioned that she would like more information about TA or community of practice calls. We got you, Kim. We'll be sure to send out all of that information in our follow-up email along with the recording so that folks can go ahead and register and sign up. We do have a brief registration link that folks will need to use. And additionally, I just want to highlight that as a part of these community of practice calls, we do have quarterly evaluations that are pretty simple, but we just want to make sure that, the work that we're doing is meaningful for folks. So that's something to expect as well, and we'll include all of that information in our follow-up. Are there any other questions that we have? Dana asks, will we be able to print out this material? Yes, Dana, I'll go ahead and send out a PDF along with our recording for everybody so that you can have a printable version as well as a web recording that folks can watch. And it looks like that's all of our questions. So I guess we will be wrapping up a little bit early. Something that I'll send to you all right now is just my contact information. So if you have any really specific questions that come up after the webinar that don't get answered in our follow-up email, you can contact me directly. And I'm happy to help however I can. And I really appreciate all of you attending this webinar today and prioritizing supporting youth peer support within your organization. Thank you very much. Okay. So there's my information there. And again, thank you all. I really appreciate you attending, and I hope that you found this valuable today. Take care.
Thanks, everyone.